These are both common issues with PFMs since they essentially consist of three artificial layers: the metal coping or substructure for strength, an opaque layer used to mask the grayness of the metal, then the outer feldspathic porcelain for aesthetics. Once the slot is large enough, I use a Christensen crown remover to separate the crown from the prep. The patient was very happy with the new restorations, even commenting that the results exceeded her expectations. For this case, we have a 26-year-old female with existing porcelain fused to metal restorations on the laterals numbers 7 and 10, which were placed to restore the teeth after endodontic treatment. As you can see from the occlusal view, through the access on the lingual, number 10 has recently been retreated. The patient's goal is to improve the aesthetics with more natural-looking restorations. Her complaint with the existing crowns is the visible grayness along the gum line, especially on number 10, and that the crowns look very different from her other teeth. These are both common issues with PFMs since they essentially consist of three artificial layers: the metal coping or substructure for strength, an opaque layer used to mask the grayness of the metal, then the outer feldspathic porcelain for aesthetics. Having made several PFM crowns in my early days as a technician, I can tell you it's extremely challenging to get the balance of these three layers correct for optimal aesthetics, especially when the overall thickness is dictated by the amount of tooth reduction beneath. I'll now take you through the prep and impression for the BruxZir Esthetic restorations that we placed on tooth numbers 7 and 10. We'll start with the removal of the PFM crowns, where I use a carbide 557 burr to create a slot through the crowns along the facial, incisal, and lingual surfaces. It's pretty easy to tell once we've cut through a PFM since the transition from metal to tooth prep beneath is pretty obvious. Once the slot is large enough, I use a Christensen crown remover to separate the crown from the prep. For more stubborn crowns like on number 10, I make an additional horizontal slot to help with the removal. Once the crowns are removed, it's time to refine the preps and also to modify the buildups if necessary. The gingival zenith on number 7 is about 0.5 millimeter lower than number 10, so I'm just checking the sulcular depth with the probe to make sure I have enough room from the attachment to raise the margin. For all my preps, I use a round-ended tapered diamond burr, create the appropriate depth and rounded internal angles along the axial surfaces, which will result in a deep chamfer margin. For BruxZir Esthetic, we're looking for a reduction of about 0.7 millimeters along the gingival margins and a 1.5 millimeter clearance. To remove the temporary filling material on number 10, I use a carbide round burr at a slow speed. This helps ensure I don't remove much tooth structure beyond the temp material. Once I reach the gutta percha, I seal the top with Vitribond glass ionomer. Now to start the buildup, I use Kerr's 37% phosphoric acid etch for 10 seconds, followed by Optibond Universal. After I apply a bonding agent, I always use air and suction to remove excess bonding agent and also to evaporate the solvents. Since the margins are slightly subgingival, I use a size 1 cord to help retract the tissue for the impression. In tight spaces, I use both a perioprobe and a serrated cord packer to place the cord just below the margins. After 5 minutes, I remove the cords and dry the preps and sulcus really well for the digital impression. Any excess fluids on the preps or within the sulcus can certainly create distortions within the impression. We first capture a high-resolution image of each prep, then the rest of the neighboring teeth in the upper arch, the opposing arch, and then we finish with the patient biting together to establish the occlusion. Taking impressions with a digital scanner is an active process where you sweep the scanner along all of the surfaces of the teeth while observing the model that's generating on the screen. After each set, it's important to analyze the model to ensure the necessary areas have been captured. Since the final restorations will be BruxZir Esthetic, the digital impression has been transferred to the lab for fabrication. I also transfer the files to our Glidewell in-office system so I can design and mill precise-fitting Biotemps Now provisionals. In the Fast Design software, I first mark the margins and define the occlusal and facial directions. Once the margins are placed, If necessary, it's easy to modify the margins by dragging the line around. Once the margins are completed, both restorations can be designed simultaneously. Here I'm using a tool called Freeform that can allow custom adjustments to any area of the design. Once the design is complete, I'll automatically set the proximal contact values using the Edit Contacts window here on the right. The designs are then transferred to the fast mill, where it'll take 6 minutes to make a perfect fitting provisional out of the Biotemps Now blocks. Once each sprue connection has been removed, we use Voco Bifix Temp, which is a very strong and easy to use composite-based temporary cement. Since these restorations fit so well and the margins are so precise, it certainly offers a peace of mind during this temporary phase while we wait for the final restorations to be fabricated, where I'll take you through the final delivery of the BruxZir Esthetic crowns on tooth numbers 7 and 10. To dispose a bit more of the prep and protect the sulcus from excess cement, pack a size 000 cord around both 7 and 10. If placing cord before cementation, ensure it's packed deep enough beyond the margins. Otherwise, cord getting trapped under your restorations would be a very bad day at the office. We clean the restorations out with IvaClean, remove any salivary phosphate contaminants that can interfere with the bonding of these restorations. We allow the IvaClean to interact for at least 20 seconds, then rinse and dry. We then apply a very thin coat of Optibond Universal inside the restorations to act as a primer for the zirconia. Once the restorations are cleaned and primed, I begin prepping the teeth for bonding. To disinfect the preps, I apply a very thin coat of Gluma, carefully avoiding the soft tissue. Any excess can be removed with a high-speed suction or a dry microbrush. Then Optibond Universal adhesive is scrubbed on both preps, air-thinned, and cured. The restorations are loaded with clear Kerr NX3 adhesive resin cement and then seated into place. With a tack cure of about 3 seconds on the facial and lingual, the excess cement enters a gel state for easy removal. After flossing to remove any excess interproximally, we final cure for 20 seconds per surface. Well, that concludes the treatment process for this case. The patient was very happy with the new restorations, even commenting that the results exceeded her expectations. Adjustments to BruxZir Esthetic can be made with a fine grit diamond burr, then polished smooth with a diamond impregnated polishing wheel.